Case study 3-1, displaced fracture of the femoral neck. While walking home from the train station, Emma, a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. Emma was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Inoperatively, she was given spinal anesthesia and positioned on an operating room table with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip in abduction, blood and fluid replacement, physical therapy, and vigilance for the development of avascular necrosis and possible dislocation. Case study 3-2. Intertrochanteric fracture. AR, age 88, slipped on wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. AR had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperative radiographs showed a non-displaced right intertrochanteric fracture. Inoperatively, MR was given a spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in traction. He had an open reduction and internal fixation with a compression screw and slide plate with screws. His postoperative recovery was unremarkable, although he was at risk for deep vein thrombosis. This is blood clots in his legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and assisted with activities of daily living such as personal hygiene, dressing, eating, ambulating, and toileting. For the case study questions, number 1, replacement of half of a joint component. I had hemiarthroplasty, substance that act against microorganisms, antibiotics. 3, in a position away from the midline of the body is abduction. Number 4, position toward the midline of the body is adducted. 5, displacement and dislocation. Dislocate prefix is dis, meaning the prefix is absence of, removal, or separation. 6, replacement, recovery, and rehabilitation. Prefix is re, meaning of the prefix means again or back. Avascular, the prefix is a, meaning not or without. Number 8, anesthesia and analgesic. Prefix is an, meaning not or without. Orthopedic, prefix is ortho, meaning straight, correct, or upright. Externally, prefix is ex, meaning away from or outside. Bipolar for number 11, the prefix is bi, meaning to or twice. Number 12, unremarkable, prefix is un, meaning not. Number 13, the adjective for the operative time span from decision for surgery to placement on the operating room table is preoperative. The adjective for the operative time span from placement on the operating room table until transfer to post anesthesia recovery unit or intensive care unit is intraoperative. Number 15, the adjective for the operative time span from admission to post anesthesia is postoperative.